Hello and welcome to the Be Formless Flow Driven CEO and VC podcast. And today I am welcoming to the show Todd Perman, all the way from Puerto Rico. Welcome to the show, Todd.
Hey B, very nice to see you again, and thanks for having me on.
No, thank you. And a big shout out to hello, everybody, all the listeners out there. Hopefully, you are having an excellent start to the week. It's Monday for you, Todd, Monday evening, Tuesday morning for me. We had a public holiday yesterday, actually. So it's, the start of, I'm calling it my Monday as well. So that's pretty good.
Sweet, that's great.
Yeah, yeah. You got the summer vibes going. I love that. Have you got like a beautiful backdrop behind you that you're hiding?
No, I'm not hiding it. It's just my bookshelf. Just some things I've collected along the way, right?
Yeah.
Different memorabilia all the way back from college. So little things says like my college days and when I sold my first company. Just whatever,
Yeah, I
all
like
different
it.
kinds of and family,
Yeah,
that kind of thing.
it's kind of all very like structured in a way and also really great stories. You can just feel like it's like this part was this and then there's this part.
There's a
Anywho,
journey. And you
yeah.
know our friend Bill, he always wears a hat, and I have my hat back there just for that purpose. So I have
Do you wear your hat when you're hosting with Bill?
no. He he's the cat in the hat. I just kind of follow suit and
Mm.
I think you had him on the podcast, so maybe
Yeah, I
your
did.
viewers know. But
Yeah.
yeah, he always wears a purple fedora, and purple is his color. So, and he's a unique individual. So I'm honored to be his partner on a bunch of things. So it's
Yeah.
good.
Yeah, it's very cool. Well, let's get into it, Todd, because I feel like we're going to have a very interesting and intriguing conversation. I've caught up with you a couple of times now, and I feel like we've already been talking for probably 15, 20 minutes pre show. So let's go. You are the CEO and general partner of Seed Healthcare. You're also the host of Kill or Cure podcast. What a title. Like, I love that title for a podcast. We'll come back to how you came up with the names. And you've spent more than three decades exploring a challenge that affects all of us, and that is, how do we create a healthcare system designed for health, not simply the treatment of the illness? And I know, Todd, we'll talk about this. It just feels like this is such a hot topic at the moment in terms of longevity, and rather than just simply treating the illness, how are we
Well,
proactively treating it?
I think it is, and if you really think about healthcare and my journey, and I'll maybe link it together a little bit so your guests know my background. I was in medical devices when I was a really young guy, and ran big companies and ran divisions for big medical device companies in the US. And then I started my own company, and it was all centered around helping providers, doctors and clinicians operate their businesses and grow, both from a real estate perspective and from a capital markets perspective. And that really wasn't a thing back then. I started that company, I sold it in 2012, and then I stayed there and continued to do that. So all of my career, I kind of started in the operating room way back when I was 22. I'm not going to tell you exactly how long ago that was. I started there, and the first time I walked into surgery, I was like hooked. I knew, I was going to be in healthcare, and I didn't really go to school for it. Didn't learn it from that end. I learned it from the application end. And when you start to look at something with a different lens than say a doctor has, you'll see different things, right? And so I became an expert in the surgical environment. Then I became an expert in the financial modeling and business side of healthcare, both from a reimbursement perspective, from a qualitative and quantitative perspective, and then ongoing from a finance perspective. I did some of the largest M&A, large projects in the U.S. And when you look at it with all of that in the 34 years that I've been in it, nothing really has changed. We're still
Mhm.
chasing symptoms. And you were just telling me about the researcher who got a melanoma, a brain tumor, and recently passed away. And you start relating that, he went searching for his own cure, right? Like
Yeah.
his research, and he was going and doing all that. And fundamentally, you know, it's the difference in and he unfortunately wasn't successful, right? And I'm linking this to a story you just told me,
Yeah,
and
no,
it
no,
is
no.
very
Yeah.
relevant in Sydney. So when you hear about that, it's like, okay, a really, really smart person took control of his own healthcare and said, I'm gonna go do something about it, right?
Mm,
And so the thing that's happened, and I've watched in my 34 years, is that nothing in the healthcare ecosystem really is set up to serve the patient taking their own initiative and driving towards their better outcome. And they're generally treating the symptoms. And a friend of mine, well, I say a friend, he was a mentor, an oncology surgeon way back when I was in my early 20s. He said, son, he called me son. I was in Texas, and they do that in Texas,
yeah.
whatever. And I'm gonna offend somebody from Texas. I'll probably offend many people here by the time we're all done.
It's a free flowing, it's and that's called raw and unfiltered for a reason, it's
It's
all good. Everyone nothing's personal.
So let me just apologize in advance if I offend anybody,
Yeah,
but,
no worries.
the don't get phone calls from Texas and tell me how wrong I am. They say "y'all" and they do say "son," and like, whatever, and he was in his probably 60s and 70s, or 60s or 70s at the time, and he goes, if we just focused on manufacturing a well patient, treat it like a manufacturing process, we would be thinking of healthcare totally differently. And at the time, I was working and, supporting doctors in the operating room with medical devices. I didn't know what he was saying. Okay. But when you fast forward 30 years later, we're still not looking at a patient and saying, okay, B, you've got this symptom. How do we look at the underlying cause and fix the root cause of that and go into
Mm,
it like we have a process of driving
it's coconut.
of driving sorry, somebody went by. Coconut, hey, come on, calm down. You can be on later. Yeah, yeah, yeah. Yeah, yeah. Normally, they don't he doesn't hear two-dimensionally, I don't know why. So, that's pretty funny.
He's probably barking and looking at the camera, this is hilarious. Oh my god, you're in Puerto Rico, I'm in Melbourne,
From
Australia.
10,000 miles away, they've connected.
2 dogs talking to each other, isn't that
Yeah,
gorgeous? Yeah.
that's funny. So
Mm,
so so when you think about it, what he said to me back then was so relevant, and I didn't even know, I didn't even realize I spent 30 years in all areas of healthcare, you know, doing that, and then I looked at it and said, finally, you know, the things there's 2 things that I would say how you really transform your own healthcare experience. The first
yeah.
one is you have to think of it differently. You have to always ask why and what's the root cause of whatever's happening, right? If you have a cough, there's a reason for it. What is it? Is it a virus? Is it this or that, right? You can go to the root cause of something simple like that. You can also go to a cancer and go, well, what's the root cause of that? Why did it come? Why did your body and immune system not proactively fight that cancer?
Mm,
Some sort of prolific impactful disease, or if we slough them off and they go away, right? So there's all different kinds of things that happen. So relative to that, the manufacturing process context really is a transformation of how you look at healthcare and then how you drive towards better outcomes. And the problem we have as a society, and I guess I'm going on a rant here, so stop me anytime.
no, no, I like it.
If you think about it, in the US, we have a problem, right? We have a payer system that is wrapped around 50 different states. They all have a different model. We have a federal senior care program called Medicare, and a lot of people probably know about that.
Mm,
But if you take the wrapper, right, and you look at how healthcare is delivered, the event is about the sick environment and what you're trying to treat, and not the holistic well process of being proactive. Okay.
mm,
In the US, that's not how it works. You just don't get to the proactive aspect until it's an afterthought. So if you take every other country, there's different wrappers. And I've traveled all over the world. Spoken in many, many, many countries, not Australia yet,
mm.
I say.
You have to come to Australia.
But but relative to that, the payer wrap is one thing that drives almost every system, okay? And the sickness wrapper drives every system as well. I don't care if it's the NHS, it's Canada. NHS is a fully subsidized system from in the UK. Sorry to use acronyms in United Kingdom, and everybody knows what that
Yeah,
is, I'm sure.
totally, totally, yeah.
And they fund care. However, they're still treating just the symptoms and they're still tracking towards the symptoms. And you go to Japan, it's the same problem. They might have some advanced medicine, but they've got a gap that's the same problem, right? They have insurance and they have a program, the government. So regardless of the capital structure of how healthcare is paid for in a country, it's the same. It's literally the
Mm,
same. So it's about the who pays the first dollar and who pays the last dollar.
yeah.
So the business of healthcare is a very different thing, and there's a framework for that that's very unique. And in the US, we have the highest cost per person. We're blessed with that. And the probably the I wouldn't say the lowest outcomes, but I would say not the best outcomes. And, we're also handcuffed with 50 different states and legislation and all sorts of complications. So when you talk about reimagining a healthcare system, do we blow it up and start over? If we did, we wouldn't have most of the parts that we have today. Okay. So, but what we can't do is tear it all down and build it back up. It doesn't quite work like that. So the way we're doing it is driving innovation into the fabric of care and delivery and making the physicians care about prevention. Okay. If you catch disease at stage zero, whether regardless, I don't care what disease it is, it doesn't matter if it's cancer, metabolic health, brain health, you name it. It doesn't, mental health, everything. If you catch it at stage zero, which is when it's developing, you can actually do something about it. If you catch it at stage four or later stage with it later onset, whether it's diabetes or anything like that, it takes a lot more to cure it. And 90% failure rate when it comes to cancers and heart disease and other things. So the key in heart disease, big thing. We were talking about that earlier as well. So for me, it's how do you reimagine it? Well, you start looking earlier for disease, right? That's my simple theory of change.
Yeah.
All the other stuff comes along with that. So we invest very frequently in early stage diagnostics, processes of care that glean diseases and why they actually happen. I spend a lot of time in research and working on innovation. And then we brought people like Bill onto our board and brought a whole ecosystem of clinicians to help drive the utilization and strategy of deploying those preventative tests into the healthcare ecosystem. So we're doing it that way. We're using capital and making money for our investors and for ourselves, but also doing good and really
Yeah, I was
impacting
about to
people.
say doing good first and foremost, because I mean, of course, capital, but you're doing it consciously, right? And in terms of, you made a really interesting point and this is quite controversial. Like, do you think that has part of the challenge or the issue been that the healthcare system at large has stayed in short term, I guess, treating the illness versus preventative because it's been a money making, like, I mean, you hear around when you talk about cancer, for example, quite often the conversation goes, there isn't a cure yet because it's a money making machine. And
Yeah.
you hear about, one of my best friends who passed away last year, and she was very young, and, like, just the cost for treatment and clinical trials and things like that, it was wild, and you kinda go, "Here's someone fighting for their life, and yet there's a cost that
It,
to." Do
it's
you know what
it's
I
an
mean? Like,
incredible cost. It's an incredible
yeah.
cost. I
Mm,
well, so let me frame that up a bit. I'd say that when you start to think about the process of care, and I have a 83-year-old mother. She loves it when I talk about her. I think she's a star on my podcast. She even calls and tells Bill to stop walking at, whatever. But
your mum
but
sounds
she
gorgeous.
actually she's quite a trip. She's a
Mhm.
fun 83-year-old. The things that the older people go through with and I'm sorry about your friend at a young age, that's worse.
Mhm.
But when they go through any diagnosis, it's almost like to the point of paralyzing, right? Like
Yeah.
because you have all of these things to consider, and generally that diagnosis is still focused on that what the outcome is, what the symptoms are and what you're treating. So you have lung cancer. My mom happened to have some lung cancer that the payer system and the model in the US is very broken, even for the seniors. They wouldn't pay for a test that would tell her the exact precise type of subtype that the cancer was. so that they could treat it effectively, they were just going to throw medication at it, which is very debilitating medication. And the medication itself, know this for fact, in the US, this particular medication was $23,000 a month. So for 30 pills, it was $23,000 a month, okay, for a 83-year-old that she didn't have to pay for it, right? She's on Medicare, but ultimately she had to go pay for the $2,000 test to figure out what subtype it was. I mean, this is just nonsense, right? Like, so the
Yeah.
fracture component, and if you even take your friend, unfortunately, at a young age, it's just as confusing because one, you don't think it should be happening to you, and two, it's you're just in that stage where it's like, I'm not ready for that. You know what I mean?
Yeah.
Like, so to decide what to actually fundamentally do and to decide what to how you progress and what steps to take to actually get to, well, why and how do you revert it, right? Heart disease, you can reverse heart disease. Cancer, you can reverse cancer. And somebody would tell you go fast 25 days and cancer won't live, right? I don't know if I could fast for 25 days.
I
I
don't
might,
think I could at all.
but some people tell you autophagy is a great way to get to
Mm,
reducing cancer risk in your
mm,
body, and
mm,
doing it for just days will help. But supposedly there's a whole mantra about fasting for 25 days and no cancer will be in your body. I don't know if that's 100% true, but people believe that. And the fundamental aspects of what steps do you take? Do you go the regular path? Do you go the all different types of alternatives? There's a million of them now. Peptides are all the rage. Everybody wants to talk about that. You hear about that. You hear about, metabolic cures and how to go about, and now they're even saying that GLP-1s help reverse
mm,
cancer and
mm.
reduce inflammation enough to do that. So when you start to look at it, you have all these decisions to make. I don't care if you're 40 something and it's too early for you to have it, or 83 and you have to navigate it yourself or navigate every doctor getting a body part. I mean, they don't that's what they do. They basically, the heart is connected to everything, the kidneys are connected to everything. They measure which body part's gonna kill you the fastest, and we're gonna focus on that one first. So that's how basically how they pass it off. So for me, I think the brokenness can be really avoided by focusing on prevention and catching disease early. And that as an individual is my mantra. It's like I
Mm,
get scanned every year, I get screened every year I can give a whole list of tests that I recommend every year for people to prevent
wow.
and diagnose ahead of any advancement towards those later stage diseases. Because if you can do that, you're gonna live a long time, and that's how you get to
Mm,
longevity. Then you can say, "I wanna live better and better and better and better and better," right? But you can't live better if you're sick. You gotta actually
no.
catch that first and treat that first. So that's kinda my simple thesis. I try to break it
It's
down.
incredible. It's incredible. You mentioned about the doctors and getting them to focus more on preventative
Mhm.
solutions. In terms of, as a general partner and CEO of Seed Healthcare, I mean, you're working with innovators, you're working, lots of different organizations and businesses. Are the doctors like, the on the front line? Are they wanting like what's the catch? Why aren't they able to focus more on preventative versus what we're talking about here, which is the fundamental problem? And like you said, you can't just kind of demolish it, if you like, and then start again. Like it's a system that has been inherently, you know, around forever in a day,
Yeah.
and it takes, you know what I mean? Like, yeah,
So first, I mean, so I don't offend this is not to play both sides of the fence. I am not gonna offend all the physician friends of mine out there, but here's the thing. The physicians want to catch disease early. They don't want
yeah,
people to be sick. I mean, that's number
no,
one. And I would just say that right out of the gate. I think that the system is set up to where they only have so much time to focus on a patient. And because of that process of care that's delivered, it doesn't matter what country you're in. I don't know how much time they spend with you in primary care in the US, in Australia, as an example. In the US, I can tell you they're on a stop clock. They got a very short
well,
window
it's
of
the
time.
same. It's the
Yeah.
same here.
So
It's
so
yeah.
so it's not because they don't wanna catch it, it's because they only have a certain amount of time, and then they get bits and pieces of information, and if you think about it, you go to one doctor and they collect information from you, right? And then they collect more information at the next doctor, and then they collect more information at the next doctor. And that might be going to a specialist or whatever, whatever. Most people don't know what happened to their elders, not clearly, right? They don't track their lineage and they don't track, well, if my great great grandmother, that they didn't really call it Alzheimer's then, my great great grandmother had dementia, maybe I should watch out for that. Like maybe I should be screening for that. So, like the history, the doctors don't get enough information and they don't have enough time to really shift to prevention. Now, the better we are enabling them with tools and resources, the better they can do. And the tools and resources also need to be catalyzed and driven by the actual consumer, the patient, okay? Who, no matter what we believe, is still the consumer at the end of the day. We still get to decide what happens to our body. And I think I would urge people to be more empowered to choose the right and educate themselves and find people like me who want to educate, who
Mm,
also want to be a resource to say, what test should I have if I have 4 generations of heart disease in my family, right? I should have a CT angiogram with AI that interprets whether I have plaque in each artery, right? So very simply, you can determine whether you have risk of heart disease. 18 million people die of heart attacks every year.
yeah, it's
Still.
incredible.
And there's a non-invasive test that will tell you whether you have plaque, whether it's soft and hard, and it will now the AI is just so much better, and you can do that, and you can do that for a nominal amount of money. I mean, money is it costs money, but ultimately, eventually the sick care system will catch up and deliver that test
Mm,
embedded into the fabric of prevention and pay for it, right? But until then, we have to have our discretionary dollars and commit them
mm,
to being proactive. So heart disease, cancer, you can screen for cancer. There's a lot of new tests coming. Alzheimer's. We just
mhm,
invested in a company that we were super excited about. And, it's actually an Alzheimer's test that catches Alzheimer's 6 years before there's plaque in the brain. I don't, and there's still the chicken and the egg. Is the plaque the cause, or is the blood, whatever the cause is, the narrowing the vessels and all the things that go into dementia or the true disease of Alzheimer's? This actually looks at a folded protein. And it's a blood test that you can actually tell if you're in the disease progression well before there's plaque. Once there's plaque formed, there's not much it's hard to reverse hard plaque and in your brain. So the goal would be to catch it earlier so that we can treat it earlier and start
yeah.
slowing down the environmental progression of the disease and do other things that are anti-inflammatory, reduce the whether it's the combination of amyloid plaque and what forms it, the different environmental endotoxins and all the things that go into it. So for me, investing in that test means that we can bring it to the US and then democratize it to the world is pretty exciting, right? When, you know, there's still 10
So
million people
exciting, and yeah,
a
so
year
exciting. Mm,
that can't actually diagnose Alzheimer's until the late stage, right? So
yeah.
so to me it's fun. It makes my life very fulfilled. Mission purpose is definitely checking the box.
Absolutely, because you are like you're changing lives here. Like when you talk about the consumer as such, there's a lot still to be done from a consumer perspective, isn't there when it comes to preventative as well? It's not just like it's almost like a sided marketplace, if you ask me, in terms of like when you think about there's the actual system itself, there's the GPs, there's the investors, there's the organizations, and then there's the consumer on the other side. And we have a role to play as consumers as well in terms of not just going, oh, something's really hurting here. It's been, bugging me for quite some time, but I haven't done anything about it. And so it's there's a real education piece here as well in terms of like, do you see that a lot? Like that there is like when I think about the double-sided marketplace, like, the system as a collective has fundamentally been the same for so long. I won't say broken, like
Yeah, it is broken.
yeah,
I no,
yeah,
you should say it's broken. I think it
mm,
is. I think
mm,
it's different layers of broken, right?
yeah,
Different so the double-sided marketplace. So when I think about that, okay,
mm,
here's the double-edged sword, right? Everybody has makes a certain amount of money, and then they have to decide how they spend it, and they have a certain basic needs, and I think healthcare is one of them. They need food, they need shelter, they need healthcare, they need infrastructure, right? Like, they need the basics, and, when you start to really look at it, the noise in the marketplace is very, very confusing to
Mm,
everyone.
mm,
It's confusing to an 83-year-old, it's confusing to my 83-year-old mother, it's confusing to a 40-year-old, and you start to look at, well, what should they do? And there's not I think I think the biggest education, the gift when I speak is this is just for me, it's great to go make money and do all that stuff, but I'm just as happy when we're impacting people's health and creating awareness around prevention. And if one person out of a number of out of a several hundred in a crowd actually go get scanned or go even understand that they can be the person in charge of their own health, I think that is a shift in the mindset that
yeah, I
really
agree.
does shift how you look at it as a consumer, okay? So and then the other part that I think, if I always talk in 3, so the second part that I think is just as relevant is the noise about what should be done or what shouldn't be done. I mean, it's bad from the pharma companies, and if you I don't watch television very often, but you hear, okay, well, this drug might cause da 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 da, and then people still go take the drug, and they're not thinking, well, is there a better solution, right? Like,
Mm,
so the consumerism of where big pharma is, how it's being driven into the fabric of the society is another, and so the misinformation and cutting through the noise is number two. That I think I think everyone should find somebody that has knowledge that's an ad that could be to ask, right? I mean, we can ask AI, right? That's getting better. I think there's some really good tools out there to really help people be in charge of their own knowledge base. So that those 2 would be really relevant. And then the third is actually making it important for the clinicians and shifting the payer system and that whole model towards more risk-based so that
mm,
there's skin in the game for the physicians. And and this goes back to the structure of the business of healthcare. And I'll tell you that the business of healthcare worldwide is, again, it's the same. There's an employer in many cases, or government, okay?
mm,
And
mm,
there's the people pay a certain amount for whatever that care delivery is, and da 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 da. And then there's the administrator of whatever that is. And in the UK, it's the NHS. Then they have all these supplemental plans that go on top of that to get private care. And then guess what happens? There's the last dollar risk. And the last dollar risk is everything above a certain amount, and that last dollar risk is generally done by a very, very large insurance company who
mm,
take risk on an entire population of people, okay? So
mm,
they're running all the algorithms go, well, I'm gonna insure everything above $250,000 or whatever the currency, and we're gonna take the risk on that, and we're gonna get paid for that, right? So all the people up to that point don't really they have limited risk and they have limited exposure to their healthcare delivery. So the brokenness of the third broken part is the payer model and the system that we're under in most municipalities around the world. And I would tell you that if we can advocate for change in those areas, which I think is happening in the US, and the consumer is going to drive that in the
mm,
US because it's a vocal consumer and getting more and more educated, but
mm,
we're not there yet. We're still now, when you invest in healthcare and you invest in prevention, can you make money at it? The answer is yes, you can, because there's enough of a constituency to move the needle and really drive outsized returns and do good at the same time. So that's kind of the model that we fall under.
Todd, just on all of that, like, I'm loving all your explanation and just the way you're explaining how broken the system is. But and I think about it like it's a connected ecosystem, and it's been disconnected for so long. And
Mhm.
slowly but surely, bit by bit, you're putting back together an interconnected, robust ecosystem for the future, if you like, because things like you talked around AI, it's getting sharper and sharper by the second. There's obviously still a long way to go. I just lost my chain of thought. I was going to ask you a question and it's just gone. Don't you hate that when you lose the question that you had? It will come back to me.
Let it pop out when it comes. It's okay.
Yeah, it'll pop back out in terms of just the disconnected and the interconnected. Whilst don't you hate that? Oh my gosh, it's now going to annoy me. It's kind of stopped me in my tracks. I guess for me, in terms of what becomes possible, I'll come back to the question because the other one will come to me at the heart of
I want
what
it
you're
when it comes, just let it go.
yeah, I
Just
will.
get it out.
I definitely. What
Okay.
becomes possible when we stop optimizing the system we have and start building the one we actually need? Like you've talked, like when I said to you pre-show, this is the question. You're like, that's a really good question.
Yeah. So so you gotta keep the train moving while you're building something new, right?
Yeah,
What I think is happening today in the US, particularly now, you're hearing a lot about prevention. We were doing it long before that. But the idea that now we're talking about the food system, we're talking about how do you really get to the root cause of it all, the vaccines and all the stuff that we're putting in our bodies. I will tell you the top 1 to 5% of the US, and I think this is true for many, many countries, they're going to look to innovate and drive, get something different. Okay. And I think you have to build that system of what that difference is alongside what exists kind of there and then democratize it, okay? So it's like you can't do it while all the doctors aren't gonna come along, right? You've gotta do it without their knowledge, and then all of a sudden you look back and you see in the rearview mirror, "Oh, look at what we put together." So we're
mm,
doing it in pieces. It's just
mm,
like the old adage of how to eat an elephant, right? Like, you
mm.
eat it one bite at a time,
Yeah, no,
and
yeah,
and hopefully you don't start with the worst parts, and,
no,
like, you go to the
yeah, yeah,
go to good
totally,
parts.
yeah,
But the idea is build it over here in with adjacency and then drag everybody else along kicking and screaming is kind of how I think, or when it's time, like if you got enough of the influential, 1 to 5% of the people, driving that, I think you can really create the traction that you're talking about with a parallel system and have that be then moved towards because there's plenty of resources in the broken system. It's just
yeah.
where they're spent, right? That's what it comes down
Totally.
to.
Which comes back which brings me to, like, I've just like, conscious capital is if you like, and then not so conscious capital because and you're obviously playing in the conscious capital space, it's around the purpose, the impact, ultimately the change that you're wanting to make. How much of that from a VC perspective do you still see as critical in terms of the healthcare system? Like, is there still, I guess I'm coming right back to, are you up against, or do you see, you're probably not because you're a trailblazer, you're pioneering, especially with what you're doing. Do you see quite often that there is still this resistance to interconnecting the system to make it better for the future, and there's almost like an old world of capital, if you like, that wants to keep it where it's at? Or do you think it's absolutely change?
I think it's simple yet complex, and I'll tell you
Yeah,
why I think that.
yeah.
I think that the doctors, when they feel the change, I think that I think they gravitate towards it, okay?
Mm, mm,
So I do think there's a yearning to catch disease earlier and actually treat it earlier. Like I said earlier, I really do believe that physiologically and mentally, they don't wanna catch more late stage cancer. They wanna catch it earlier
mm.
or heart disease or they don't wanna hear about a patient. Most of the time, the doctors only hear later about the patients that have a heart attack and die, right? Like, they don't.
Yeah,
So for me, I think like that part, I think there's a movement towards that. It's just that how they make a living and what their responsibilities are today are so bogged down in that care delivery that there's a real problem with that.
mm.
Hey, come on, buddy. Come here.
Coconut, Charlie Bob's just waking up.
Yeah, come here. Stop barking.
Oh, so cute.
So he's well trained, really.
Yeah. So
So yeah, he can make a guest appearance in a minute.
yeah.
So that's one part of it. The I think really where the and I don't think it's all insurance company. I think there's a structure around the payer model that until that really shifts, the incentives are misaligned. And I
Yeah,
will
okay.
just say, so I think that the clinical world wants it, and there's a movement towards that, and the patients are going to drive it. I think that the payer model is still stuck in symptomatic care and throw medication at it, and not look for alternative solutions. And for me, it's like, okay, if I had cancer, I'd want to look at all the treatments, and I want to look at all the alternatives. I want to
Mm,
look at all. I want to be able to make an informed decision and take the knowledge base that I have and apply it to what my care delivery and program was. And, sure, there's traditional care delivery that's targeted immunotherapies today that work in cancer.
mm,
There's some really good things happening in cancer delivery and cancer care. And you'd be foolish to just cast them away and not look at them. So I wouldn't urge that. But what I would do is I would look at how I restore my mitochondria while I do that,
yeah,
because your mitochondria are like a powerhouse for your body,
100%.
and they power you to actually fight the cancer. So, like for me, I would take both
Mm,
traditional medicine and the innovations that are out there in traditional medicine and align it with my care delivery that I really want. Same thing goes as a as a man. I want to have muscle mass when I get older. I want to be active. I want to live well. And so I'm doing the things that I should do fundamentally to do that. Right.
mm,
And I think we all have that responsibility. And I'm not sure that our generations before us did that really, really well. Some people did.
no,
I wouldn't put it all in one box. Some people were in the gym all the time. Some people were not. And, I'd say that generationally, this generation is more my generation, you're younger than me.
yeah, I'm
My
40 oh, I'm
generation,
48. I'm nearly
you're definitely younger than me. But I'm, you know, 57, so not bad.
yeah, look at
Thank you.
yeah,
So for me, it's the work that goes into that, and then individualizing healthcare. But say that the big move is going to be when the payer system uh, shifts a bit, and the risk is put back on the clinical environment to actually have the patient live longer and have a more meaningful life, right?
mm.
And to me, right now, that's just not one of the incentives. It's just
So
not.
then so then how does the pair system start to evolve, start to shift? Like, what is it going to take? Like, you're doing such amazing, incredible work, and yet we've got this system that is kinda not shifting. And so, like, what do you
One
do?
one
Yeah,
piece at a time, right? Like you
back to the
still have to
elephant.
go back to that physiologically, one piece at a time. To me, it's a very important thing to say, because each part in each disease state has a different risk and a different profile. And so where does it shift? And in the US, I'll just use the US as an example. Study it, right? Like you think about it, all the last four presidents have ratified that we are going to full risk under Medicare in 2030. Okay. What that means is the payer model shifts to where the doctors get assigned patients, whether it's you or me or whatever, and they're responsible for delivering that care, and they get paid a fixed amount no matter what happens. Okay. So then, and they get paid a fixed amount. I say that not no matter what happens. And let me retract that. Based on their outcome and their care delivery and the patient doing well. And if the patient dies, they don't get paid anymore. Okay. So the incentives are aligned with having that patient live better and live
Yeah, okay.
longer and getting into prevention. So it's not just like here's a blank check and it's in perpetuity. It's actually do something with it and fundamentally care for the patient in a different way, right? And to me, I think that's going to be when the shift really starts. I think it's going to take a while for it to be executed. So they say it's 2030. I don't think, and that's the government driving it. I'm not sure how they're going to do that. But the smart healthcare people that are out there are a lot of them that have been innovators, and the smart healthcare people are moving towards that, and they're layering it in. And then there's the other world, which is this democrat that we're building in a parallel universe of call it the affluent or whatever you want to call it, the top 5% of the country are driving what I would call innovation, so that then when the cost comes down, it meets innovation goes and gets democratized to the rest of the people. And the goal is to take that. I'll just use an example of one of our projects, the Alzheimer's test is
I was gonna
coming.
ask you that to check
Yeah,
it check yeah,
it's called Diadem. It's not on the market yet, but it will be later this year. And we just closed the investments out of Italy. Italy's great innovation country, but they haven't created access to the US and the ability to commercialize. So we really fit well. And so that test we think will come on the market in the $700 cost range. And I can tell you there's plenty of people who are worried about Alzheimer's who would pay $700 to know if they have the
yeah,
disease or not, because the worry raises your cortisol levels and raises your risk of the disease and probably builds more plaque, right? So knowledge can actually and inflammation is a big part of all this. Almost all of the inflammatory markers are things that we watch at some of our portfolio. And one of another portfolio company is Fountain Life, which is a membership program where they watch all those markers. They do all the testing for you, and they do all of that. I mean, this is not a commercial. I would list out the tests, and I would tell you, I don't care where you
yeah,
get them.
yeah,
Get off the couch and go get the test, right? Like, go get a
totally,
CT angiogram if you have heart disease in your family. Go get a full body MRI if you've got cancer risk and you know that there's risks of that, and tie that together with some of the blood biomarker tests and really determine your 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 ground game around how you're gonna catch disease early. Well, look at your blood. I mean, there's
yeah,
so many biomarkers now, LP little a, ApoB. If you're measuring those things, you can tell if you have heart disease or not. And
yeah,
instead, people just go for a walk and they have heart attack.
mhm.
That's not the way I wanna go.
No,
That's not it.
a couple of fun questions for you. I feel like the younger generation are more focused on, their health, longevity, like you look at the stats around drinking culture, like like there's not as many people drinking, younger generations drinking these
True.
days. Excuse me. Do you see a pattern emerging with regards to the younger generations taking up more preventative, more longevity versus like, is that the opportunity? I guess is my question. Is that the opportunity to help fast track the change
It
that is required
it's a
to
very good question.
into the, mm,
Yes. Yes and no. And I'll tell you really the generational change
mm.
is really happening as I see it. Remember, my generation didn't have a cell phone. My son would ask me, I've already told you works in our firm. He's
You know what?
super super blessed. But when he was 7, he asked me, "Hey, Dad, did you have electricity when you were my age?" That kind of thing. And we didn't have cell phones when I was a kid. We didn't have
Yeah.
all the electrical stuff. We didn't have all this stuff. I didn't get my first cell phone until I got out of college. I had a beeper. Okay, and all of that has its challenge. Okay, hormones today for a 25-year-old male are lower than when I was 25. Okay. The same thing is happening in women. We're putting them on birth control at a very young age, and we're basically interfering with their hormones because it's a, it basically is it's estrogen. They're doing that at a young age so that they don't, have the risk of getting pregnant, but at what cost? Right.
Mhm.
And I don't believe that the younger generation is getting tested for their hormones and proactively looking at how they are. But food,
Yeah.
phones,
Processed
all of
food.
it,
Yeah,
all of the
agreed.
processed food, all of it. And I don't want to, I mean, again, people are going to go eat McDonald's or Burger King. I'm not against, fine, go eat what you want, but the plastics in the food and how that affects you is really it affects your thyroid, it affects your hormones, it affects metabolic behavior, and and those are the things that. So go back to the younger generation. Yes and no. So to
Yes,
answer your question
fascinating.
very specifically, the yes is yes, they're paying more attention now, which I'm really thankful for. And I would urge all the young people to get tested, you know, more than they think. They think they're 25 and they're invincible, just like I was, and I was, of
Yeah,
course, in my own head, I'm still invincible, you know, but when you test for it, that's the only real way you know. And so if you go test your hormones may be perfect. okay? But a full metabolic panel and a full hormone panel and a full look at that will tell you a world of information. And at 25, there's a lot you can do about it.
Yeah, I
Okay.
wish yeah, I don't believe in regrets, but I definitely wish I had a few things tested earlier than
Yeah.
finding out later in terms of that. It's a really interesting yes and no response.
They're
Fascinating.
paying more attention today than, I mean, they'll go cold plunge and they'll do the sauna and they'll not drink as much, but they're also not procreating as much.
No, no,
Okay.
I
We have
mean,
a
the stuff yeah,
we have a
are
declining
astounding.
population in the world.
Mm, mm,
And, we've got gaps in age, and if you go to Japan as an example, I think there's a very huge age gap, like young 20s and to 30s, and then elders, right?
yeah,
There's nothing in between, right?
no.
And, I think there's a lack of procreation, and that can be, hormonally driven. It can be a lot of different things, so for me, that's part of the motivation, right? Like,
Yeah, another problem to solve. Yeah, like it's a continuous. So my final question for you, I was at the footy yesterday, AFL, Australian Football League. I don't know if you've ever
nice.
seen it. I know your daughter's in Noosa at the moment. It's rugby league up there.
So, and it's rugby. It's all rugby, right?
Yeah, well,
I played football as a younger guy and got
this
my
is
butt.
different. This isn't
No, no,
rugby.
I know. And I
Yeah.
hung out with all the rugby players in my dorm, and they were lunatics,
Mm. Yeah,
like
totally right.
complete lunatics.
Yeah,
And
so football's a bit different. AFL is different in terms of it's a different shape of football.
mm,
It makes more sense to me. Anyway, it was public holiday here yesterday. I went to the football. It was a long weekend. It was the King's birthday, and it's an annual rivalry between Collingwood and Melbourne, and it's for Fight MND. And so
okay,
Neil Danaher was a champion footballer. He was diagnosed with motor neurone disease, and listening to you today and again watching the segment on Richard Collier, who had brain cancer, he had been a leading researcher in melanoma. And here we were yesterday at the football, and you should have seen it, Todd. It was unbelievable. I think it was like the 12th or 13th big freeze, and there's no cure. So they're raising money to find a cure. And then there's, not just Neil, there's a number of, he passed away a couple of weeks ago. There's a number of people out there. And then there's this 30-year-old guy there yesterday, a rugby player who had just recently been diagnosed. My question for you is, because I walk away from those situations and I'm like, we have to find a cure. We have to solve this. Like, this is like, this could impact any one of us. And it just gives you such a perspective. It didn't matter about the game, who won or who lost. We lost yesterday. I was annoyed. Don't get me wrong.
sorry.
I walked away though with looking at like over 90,000 at the game, and this camaraderie around everyone is like going, we have to solve this. And comes right back to your preventative longevity.
Yeah.
I guess my final question to you is, you're at like the frontier when it comes to clinical trials, a lot of what you're doing and with Seed Healthcare and the companies that you're investing in, and obviously you've got the cyclicarity. I don't think I'm
High
pronounced it.
clarity.
Yeah, the
Yeah.
cyclicarity
High clarity. That's a good one.
heart attack trial that could solve or create a cure here. How far off are we from cures for diseases at the moment that don't even have a cure? And I mean that's probably a really loose question to ask you. Like, that would be my final question for you in terms of, do you think we will ever get to a point within the healthcare system where there will be a solve for diseases that have been around for a very long time and still don't have an answer?
I That's it's a good question and a hard one to answer in some ways,
Mm,
but
mm.
also easy. And I always look at things in a way where you go, where is on cue. I always look at things in a way where you look in the rearview mirror to know where you're going, right? And there's very few cases of polio today.
Mm.
Okay. Now, I will tell you, it took us, I can't cite the exact number of years, but let's say the healthcare innovation for the last 50 years has been pretty good. Okay. We've learned a lot. Come here, buddy. Come here.
Yeah, I'll get my
Well,
bub on. Come here.
Yeah, we've learned a lot, but I'll try and keep my focus here. Oh, we're doing the dog. Yeah,
I
I
can't
gotta
see
lower
what
my desk. He's a little big for me to here, come here. He can show his face. Come here, buddy.
it's always
Is
the
he
way when they don't wanna Marley Bob's grumpy because he hasn't been for his walk yet.
well, come here. Come here, come here. Come on, further away. No, come here.
Marley Bob, look,
Come on,
there's
puppies.
Coconut. Say hi,
Okay.
Coconut. Hi,
He's he's
Coconut.
he's got a prettier face than I do. So we're gonna okay, good boy.
Oh, so
So
cute.
so when you think about it, it's like, and now I'm losing my train of thought. The idea that that you focus on that, and you get the real proactivity of where you're going, and bring it together. I mean, my dog just made me lose my total train of thought. So you
No,
did
no,
it
no,
once,
you
I
were
did.
just saying polio, and, like, if you think about polio,
So
there's not
so if you think about it, you have 50 in that 50 years, we figured out a lot of diseases,
yeah,
okay? The innovation that we had was pretty weak,
yeah,
okay?
yeah,
AI tools, we can compute so much more today. We're gonna figure out a lot more really, really, really soon. And I would tell you that we will probably see the 50 years of innovation in the next 5 years, okay?
mhm,
And then beyond that, in the next 5 years after that, we'll see, like, even faster, right? So, to me, the innovation is really like you take all I mean, you take all the computing power, you take all that stuff, and you just take and compound it with Moore's law, and then you go beyond that because that's where we are now.
yeah,
Like, there's
incredible.
this incredible amount of information that we can process in a very, very brief instant. And when you see that innovation, just like some of the portfolio companies we're working with, the innovation is just happening so fast. 50 years of medicine, crossed over in a very brief period of time. Okay. And, now we're going to see in the next 5 to 10 years complete innovation that's going to new body parts that we didn't expect that we'll have. Like,
Incredible.
we'll just take your heart out, we'll put in a new one, and that's just right off the shelf. You know, I've met the innovators, and I have a lot of hope that, come on, man. I, I have a lot of hope
I love it.
that,
He's like, "He's like, yes, Dad." You have
yeah,
a lot of hope. I love it. It's incredible.
I have a
Todd,
lot.
it's
Hey, come
such
here.
a
Come on, buddy.
he's
Come on.
like, "It's
So,
time. It's time to wind
so,
it up. It's dinner time."
yeah, so it is dinner time.
Todd,
He's at 7 o'clock,
yeah,
like clockwork, dinner
totally
time.
right. No, 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 I get it. Todd, how do you so what keeps you going? Like, is it the innovation? I love your energy. I love your passion. We've been talking for 55 minutes. Can you give us one piece of advice in terms of
Shh, 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 shh.
for
Come here.
people that are,
Okay.
I guess for founders, for businesses, for leaders, like what is it that keeps you going? And then the second one is that what would be one advice you'd give anybody to go and get a test on, right? Like after listening
Okay.
to, so
Happy to do that. So first, the mission and purpose of what you're doing is what really drives me every day. So for me, that's what it is. So always ask yourself, just like I say, ask why in healthcare, ask why you're doing what you're doing.
yeah,
Right. Like, and if you have a why, I have a why, and you'll probably ask me what it is, but I watched I watched my dad die at too young an age, and and it also motivates me every time I see, you know, the things that can happen that don't happen, and so I want to be a change agent, right?
mm,
And look, I've been blessed in my life, and I'm super fortunate. So my why might be different than your why, right? It doesn't matter, but have a why, and that's the motivator for me. And my kids also factor into my why, which is really cool to have my son working for us,
yeah, it's
with
beautiful.
us, because I've watched him grow well beyond his years and 2 years of working, where I know I worry about the generation not getting the things that I got, and I
Yeah,
had great mentors
yeah,
and learned a lot at a very young age, so I worry about that for all the young people. So I would find good mentors, and I'd find your why, and do it at
yeah,
a young age if you can.
yeah. I agree.
And that's my reasons. The other side of it, which I think is another framework of a good question, what tests would I have? One, you can do a lot with a really, really good deep blood test that
Mm,
and if you haven't had your blood tested, as a young person, you don't need a lot of invasiveness, but a blood test is not invasive. It's take your blood, see
Yes.
what you've got, what you're working with. You can tell if your blood sugar is way off the charts or your, thyroid's not performing or your hormones are out of whack. And you know what? I'm not going to be surprised by anything that somebody would find because I've seen it, right? I've seen 20 somethings that are fit, that look the part, hormones completely out of whack, okay?
Yeah.
Like, so I think there's a lot to it. So I would get a blood test at full,
Yeah.
and it depends on your age and history, but I would definitely, if there's heart disease in your family, I would screen for it. I would do watch your cholesterol. You can look at LP little a and ApoB. Those are little biomarkers that the cardiologists look at to say, where's your risk? Or the primary care doctors would look at it and say, where's your risk? I would look at, if you are a little older, in your 30s and 40s, well, probably late 30s and on, and you have heart disease in your family, I would do a CT angiogram to get a baseline, which is a CT with contrast that looks at what's actually in your arteries. Okay. And that's available in almost every country now. And there's different companies from different countries, right? Artria is one that one of our board members is invested in, and that's actually in Australia. It's an Australian company.
There you go.
So they're there, and you can get that test in Australia. You can get the same test, very different variation in the US with other types. And, certainly if you put in the show notes or whatever, people want to reach out to me, they can message me or whatever.
Will definitely.
That would be that. And then cancer, I would do full body MRI, brain scans. I do that every year. I would, as you age, I would do it more
Yeah.
perimenopause to postmenopause, all different
Totally.
types of
Yeah.
stress. There's a lot of stuff to
Yeah. I
just
agree. No, no, no. Get tested. It's you fundamentally use get tested, and you might have to fast for a little bit through the blood test. And it's not hard. Like,
no, you
that's
want a
it's
fasted blood test, and that's how you're
yeah,
gonna know what you're
totally,
dealing with.
absolutely. I love
I
it.
think
Understand your why, and then get tested. It's quite two very simple
keep it
instructions.
simple.
Keep it simple.
That's it. And measure. Everybody wears wearables now. Measure it. Like, pay attention to the data,
I don't have
you know?
wearable. I need to get one. I'm resisting it, to be honest. Just more tech on me. I'm like, you know,
We got jewelry. Okay.
jewelry. My
Yeah.
gosh, Todd, what a conversation. Amazing. Very, very insightful, super educational. I love the change agent and what you're doing. How do we find out more about you? We absolutely need to listen to your or cure podcast as well. I'm sure you and Bill have like quite the conversation.
And
Yeah,
we
how do
have
we find
guests
out?
on too, and certainly, we'll be open to that.
Yeah,
I'd say, we'll give you all the details. I think, my marketing person can give it to you. LinkedIn,
I've got it all.
email, you've got it all. You put it in the show notes, and certainly you can go to our Seed Healthcare website. It's www.seedhealthcare.com. My email's on there. It's not hard to find me. And I'm super happy if I'm helping people actually be aware of their health, just as much as us making
Mm,
money and doing all that.
yeah.
And we want to do all of it, but
Yeah, we need to get you out to Australia. You need to come out. You and Bill need to do a keynote at some point here.
that would be a lot of fun. I would love to do that.
Yeah,
And
absolutely. Yeah.
let's find a reason. Let's make it happen. I mean,
Yeah,
we'll
for
do it.
sure, Todd. And a big shout out to Coconut and Marley Bob and the listeners. Like, a little bit of entertainment is always great, to have the little furry
Well,
friends as well. Todd, I'm going to let you get to your evening. Thank you so much for your time, and have a wonderful week ahead, and keep doing what you're doing, because it's incredible, and thank you.
thank you, Wanda. Appreciate it.
Thank you.
Appreciate it.
Ta. Thank you.
Ciao.